Meet our patient. Our patient is a 40-year-old African-American male who is 5'11", 221 pounds. He currently suffers from hypertension and obesity and is visiting the primary care doctor for a physical examination and to renew his blood pressure prescription. His medical history includes drinking on a regular basis, eating an unhealthy diet, lack of regular exercise, and smoking for the past 10 years. Our patient suffers from chronic sinus infections and has been battling hypertension for 11 years. He has also suffered from depression due to the suicide of his wife. The patient's father died at age 49 due to acute myocardial infarction and also suffered from hypertension. His mother suffered from hypertension and diabetes mellitus as well. His brother died at age 20 due to complications with cystic fibrosis. In the past year, the patient has gained 25 pounds. He went from weighing 196 pounds to 221 and currently has a BMI of 31. His average blood pressure is 155/96, which is stage 1 hypertension. His blood pressure should be closer to 120/80. He has an average heart rate of 73, which is considered moderate for 40-year-old men. The patient claims that his overall health in the past 12 months is good despite being on 3 medications. The first medication prevents his body from absorbing too much salt. He also takes a decongestant that shrinks blood vessels in the nasal passages. Lastly, he uses a spray that is used to clear airways, chest tightness, wheezing, and coughing. The public health impact of hypertension is widespread. Hypertension has a strong association with cardiovascular disease and premature death. About 29% of Americans suffer from hypertension and about 20% of the world population. For people younger than 45, hypertension affects more men than women. For people over 65, hypertension affects more women than men. There is a higher incidence of hypertension among lower socioeconomic groups. 36% of people living in the most disadvantaged areas have high blood pressure, compared with only 28% of people living in the least disadvantaged areas. The mechanism of hypertension can affect heart, eyes, arteries, kidneys, and can disrupt overall blood flow throughout the body, also leading to possible erectile dysfunction. Hypertension is classified as the elevation of blood pressure that is ascribable to several factors, including lifestyle, genetics, and family history. Chronic hypertension can lead to arterial stiffness, increased systolic blood pressure, and ventricular hypertrophy due to increased afterload. A common symptom is myocardial hypertrophy, which is when the cardiac muscle of the heart thickens. The heart has to compensate for the elevated blood pressure. Left ventricular diastolic function is often compromised during hypertension. People with hypertension are 4 to 6 times more likely to have a stroke. In addition, the likelihood of developing other forms of cardiovascular disease increases greatly. For treatment and rehabilitation, exercise is crucial. Moderate aerobic exercise should be done most days of the week at an RPE of 11 to 13. Resistance exercise is recommended 2 to 3 days per week. Patients with severe hypertension, cardiovascular disease, and those using medications should add exercise only after being evaluated by their physician and initiate such a program under medical supervision. Recommended lifestyle changes include cessation of smoking, a healthy and balanced diet, limiting alcohol consumption, and a regular exercise routine. Medications may also be required to stabilize blood pressure levels. To end, here's a letter to Mom. Hypertension or high blood pressure can lead to stroke, heart failure, kidney damage, and other dangerous symptoms. Diet and exercise paired with medication can lower blood pressure and even reverse the effects of hypertension. Yo, be careful, Mom. High blood pressure can kill you, so get off the couch.